Well, welcome back. You're watching the full view here on the SABC News channel. Thanks for staying with us. So we did indicate that we'll have the Health Minister, Dr. Zweli Mkhize. You'd recall, of course, he was in the Eastern Cape today with President Cyril Ramaphosa, monitoring and, of course, getting feedback from those working there to fight against the spread of COVID-19. The Health Minister, Dr. Zweli Mkhize, now joins me via Skype. A very good evening to you, Minister. Thanks indeed for your time.
Good evening, Griselda. Good evening to all the listeners.
Minister, I know it's been quite a long day, but let's look at the figures from last night. We were looking at over 12,000 with 219 deaths and close to 8,000 recoveries. Has that figure changed?
Well, the figure at the moment is 12,739. It's gone up. And the numbers of those who have passed is 238, and we would like to convey our condolences to the families and those relatives who are affected. So at the end of the day, we have seen an increase in most of the provinces, and the total cases would be for Eastern Cape is 1,569, and for Free State is 145, for Gauteng is 2,135, and for KwaZulu-Natal is 1,444, and Limpopo 55, Mpumalanga 67, Northwest 58, and Northern Cape 31, and Western Cape is 7,235. That is equal to 56% of the total number of positive cases in the country.
That's quite a significant jump, Minister, notwithstanding, of course, the recoveries that the country does have. Is this proving to be of much greater concern to you and government, in particular because you have put in the necessary measures in place to ensure that somewhat the spread of the coronavirus is minimized?
Well, at the moment, we are seeing recoveries coming to 5,676, which is also a very significant number. But we are concerned. We do expect, though, that the numbers will keep increasing. I think it should be recalled that when we started talking about coronavirus, we said that we would not be able to stop the infection from spreading. All we're going to do is to try and delay the rate at which it spreads, and therefore we call it flattening the curve. And this we had achieved to a great extent with the lockdown. And I do want to say that, in fact, the lockdown, so far as it was concerned, it was a fairly successful, it had a successful intervention, because at this point, we've now been able to do a lot of screening. We've screened very close to 10 million people in the whole country. We have also been able to do over 400,000 tests. And this has given us a sense of the extent of the infection, although we still need to test more. So there has been success of that. So what is now worrying us is that the pattern we are seeing in the Western Cape is what we call cluster outbreaks. That's what is pushing the numbers of the Western Cape up. It is more that there are people who are in one setting who then get infected and they come out as a group. So it would be in retail shops, it would be in factories, it would be in processing farms, and this is what creates the numbers to go up very high, because people work in one factory together. When there's an infection of about 60 people, then they go out to 20, 30 different villages where the infection will be spread by each one of them. So that is really the challenge that we have to face now. But it's going to happen now in other parts of the country, and therefore we now need to understand we're going to deal with the pandemic on the basis that the figures will go up. We'll try and put them down, and slowly we will go back, and then we'll see that the numbers go up again in another part. We have to again battle it and push it down, slow it down again. So that's going to be the issue. So flattening of the curve is not a once-off event. It's a daily struggle. That's why we say to our people, everyone must join the fight, because it can only be defeated when every one of us takes responsibility.
Minister, I'll talk about the cluster outbreaks very shortly, but I want to talk about your visit to the Eastern Cape with the President. This is the latest one. The province has been criticised for its handling of COVID-19. Are you assured of the efforts there now?
Well, I think that COVID-19 is a new infection that all of us can't be, very knowledgeable about it. So we learn as we go. So if there are mistakes, we'll understand that. But I would say so far, from the president to the cabinet to the various provinces, we've tried and done our best. And therefore, we learn each time when we see something that's not going right. So the president has led fairly strongly from the front. He has actually helped us to pull all the various departments to play their role and also, take the public into confidence every now and again so that they know we're managing the situation, but we need the public to work with us to try and slow down the spread of the infection. Various provinces have done their bit, and we've actually seen Eastern Cape, they were a bit slow at the beginning, but I'm quite happy with the fact that they've caught up, their strategies in place. There are other activities, human resources are in place, the infrastructure is in place. So I think they're coming along well.
Minister, you just spoke about this very briefly a short moment ago. One thing is clear that there are these cluster infections, what Professor Karim had previously called bushfires. You spoke about that in the Western Cape where we're starting to see that. Talk us through what these cluster infections are and how they could possibly be dealt with.
Well, the way we've seen from various countries how this thing works is that the infection moves from one person to the next person. So if it's one person to the next person, it might be slow, but it basically becomes what we call a community infection, community transmission, where you either would know someone who would have infected you, or you get it without knowing who infected you, but it moves from person to person. Then you get a situation of what we call super spreaders, where one person in a setting can spread to a large group of people, where one person could maybe infect 5, 10, 15, 20 people. And then by the time you discover, so many of them have actually been infected. So these cluster outbreaks that we are seeing in the Western Cape are more that kind of experience where somebody has got infection, is not detectable because maybe it's asymptomatic. By the time we find out, so many people have already got the infection that they already themselves have started their own sense of infection in other parts of the country. This is what's happening in the Western Cape. That is the main explanation for the numbers that we are seeing that are rising very fast, because if someone was in a shop, like a retail shop, then they were found to be positive, then you test, and then when you come back, you find that 25 people are infected, but they don't live in the same village. They live in different villages. That's where the infection has already spread already. So whilst they're busy in spreading the infection in their own cluster, the infection is also spreading by those who have been contacts in different villages. That's what's driving the numbers in the Western Cape.
The President also spoke yesterday about staggered and targeted implementation of the lockdown going forward. Minister, I'm talking about level 3 only applying to some provinces. Is this based on these cluster infections?
Well, we are analyzing the level of infections in different parts of the country. We've divided them into about 5 groups. And these groups are basically a theoretical line that we've drawn, which basically says how many people per population are infected. So when we look at them, there are a number of districts where there's very little infection or no infection. Sometimes they go for a few days without any new infections. Those groups, we think that they are low-risk areas. Then there are others where there's a huge, huge rate of spread of the infection, such as what you call in the metros, in Cape Town, in Johannesburg, in Durban, in Nelson Mandela Bay, and so on. The rate is very, very high at that level. When you look at those, you realize that you need stronger and much stricter mechanisms to manage the outbreak, as opposed to the ones that already have very low infection. So we're approaching it from a point that where there's low infection rate, we need vigilance so that we can contain those infections that have already broken out and make sure that we detect new ones and act. Then on the hotspots, those are the ones where there's a huge amount of infection that's going on there. At that level, we are now changing the strategy to do targeted interventions. That's where we are now dividing the whole area up. In a city like Cape Town or Nelson Mandela or Durban, you divide it into a cluster of wards and attach a team of specialists, medical personnel such as epidemiologists, family practitioners or community health specialists, nurses, and so on. When you do so, you will then expect them to seal the place up and move from person to person who's positive, take them to isolation, then they deal with the contacts, from contact to contact, take them to quarantine, then they start screening again to see how many people could still be having an infection, take them out to isolation or for treatment or for quarantine. That way, that's how we're going to manage the hotspots going forward. It's a much more intense intervention.
Minister, I have to ask, the threats of court challenges against the lockdown, do you have any fear that this will set us back in the fight against COVID-19?
It's just unfortunate. The issues about challenging the lockdown have got nothing to do with the health interventions. They've got more to do with other interests, business interests, commercial interests, and so on. So as far as I would be concerned, I think what we need to do is to focus on educating the society, where we will need to make sure that people understand that to fight these outbreaks, we need everyone to cooperate, and we need each one of us to take responsibility for creating conditions that reduce the spread of the infection. So we will fight the court cases when they come, but our main focus is not the court issue. Our main focus is that we have lives to save. And if we have to go that route, we need to make sure that whatever we do must allow people to be able to take responsibility to reduce the spread of the infection whilst we manage those who are already infected. And then we need to then balance the issues of economic activities, social activities, on the basis that it must not worsen the spread of the infection.
Minister, just finally, we saw in other countries who experienced COVID-19 before us, where there were cases before us, there was a challenge of the running out of protective gear. How are we faring as a country? And are we using this opportunity to build our manufacturing capacity of medical supply?
Well, we've just been into this COVID-19 for the past now almost 2 months. So what we have started doing is to try and build up our local stores to be able to get suppliers from manufacturers abroad to build as much of our supply as possible. And there we're doing fairly well, because what we are now having is stock that should be able to cover us for the next 6 to 8 weeks. And thereafter, we're going to continue to order some additional stock. Already there are discussions at the level of the ministers to look at how to create local capabilities to sustain ourselves and manufacture as much of the PPEs, the medication that we need, as well as some of the vaccines, the rapid test kits. Those discussions we're already having, but there won't be something that can take a short time. We need to work on it over a period, because it will require licenses, it will require adequate technical skills, it will require adequate financial investment, but it's the way to go. We have to try and ensure that of the most essential of stuff that we need, we should be able to produce some of it. When we looked at our stock level, we were shocked to see that on the PPEs, only 10% capacity to manufacture exists in the country. It needs to be improved. It needs to go up to 90% so that we don't have to rely on anyone else in case there's an outbreak such as this one of COVID-19.
Minister, the WHO, the World Food Programme and UNICEF have raised concerns that we shouldn't also drop the ball in terms of fighting other diseases such as malaria, HIV and TB. In speaking to the World Health Organization in Africa yesterday, they say that they've already seen a lot of shift in terms of money towards the fight against COVID because of the precarious situation that the world finds itself in now. Are we as South Africa vigilant about this?
Well, I think it's going to be very difficult to keep the right balance here. At the moment, the crisis is COVID-19, so we have to do everything to stabilize that situation. In the meantime, we have to also keep a balance on those who are on treatment, on antiretroviral treatment, those who have got diabetes, those who have got tuberculosis, those who have got all sorts of other manageable conditions. To keep that balance sometimes makes a very tough call on the available resources. So it's a balance that we have to keep on a day-to-day basis. But having said so, we believe, therefore, that if it's a cause of morbidity or mortality, death or ill health, it doesn't matter which one it is. The point is that we need to try and help our people to be saved from any infection or any condition that could be prevented. So we would like to continue to maintain a high-quality healthcare service on the one side, whilst we battle with the pandemic on the other side.
Minister, thank you very much indeed for your time here on the SABC News Channel. Health Minister Dr. Zweli Mkhize, who's joining us this evening, fresh off after arriving from the Eastern Cape. He was, of course, visiting that particular province with President Cyril Ramaphosa just to assess what the provincial government is doing there in the continued fight against COVID-19.